Good afternoon, everybody. I'm Priyanjali from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart all the time is a quest of humans. So let's connect today with our skin expert, Dr. Sindhu Raghvi, live from Chennai to talk on acne management. Dr. Sindhu is a passionate and empathetic dermatologist with extensive experience in diagnosing and treating various skin conditions. She did her MBBS from Meenakshi Medical College, Kanchipuram, Tamilnadu, Diploma in Cosmetology from Annamalai University, MD in Dermatology from Sree Balaji Medical College and Hospital, Chennai, and MRCPS from Royal College of Physicians and Surgeons, Glasglow. She has experience in various cosmetology procedures and adept in improving skin health through the implementation of corrective methods and procedures. She has also many publications on her name. She is currently founder, consultant dermatologist, and cosmetologist at Carves Skin Clinic, Chennai. Thank you, Dr. Sindhu, for joining us today. It's our pleasure to host you. Doctor, our first question for you would be, can you please start with what is acne and what are the types of acne lesion?
Okay, see, acne is the inflammatory condition of the skin, which arises from the sebaceous glands. So we tend to have a lot of oil glands in our skin, which is most commonly seen on the face, and then you have a lot on the chest, you have it on the hands, you have it on the back. So these are the areas where you develop acne. It's not only the face; you can develop acne on the body also, wherever you have sebaceous glands. So acne is an inflammatory condition which comes from these sebaceous glands, and added to it, there could be an infection also.
Right. Uh, Doctor, what can be the causes of acne? What can be the reason behind it?
So acne has got a variety of reasons. It could be external factors or it could be internal factors. The teenage acne that you see between the age of 13 to 19, that is usually hormone dependent. It could be because of hormonal changes. But in general, external factors could be application of certain thick creams, application of steroidal creams on the face. A lot of fairness creams which contain steroids can also cause acne, and some of your makeup items, foundations, your primers which can clog the pores can cause acne, and internal factors like hormonal issues, irregular cycles, polycystic ovaries, these can develop acne, these can lead to acne formation. And also diet can also play a very important role, especially when you take foods which have got a lot of sweets, dairy products, whey proteins, these can also induce acne. And there is also drug induced acne which can happen for people who take certain medications like antidepressants, who are on hormonal pills, anticonvulsants, people who take medications for fits, they can also develop acne. Acne has also got a genetic background. Some people, if their parents had acne, the children can also develop acne. So genetic reasons are also there behind acne.
Right. Doctor, as you already mentioned, that acne can occur in specific areas of our body. So, does it mean that, specific areas can have different causes behind it?
Now, the cause would be the same. For some people, it's just confined to the face. For some people, along with face, it can also happen on the chest, on the body as well. But the underlying reason would be the same.
Right. Doctor, what are the grades of acne?
As in grace, as in
Uh, uh, as in, what can be the different grades,
oh, the
starting
grades of
from the
acne.
initial
Grades, grades.
stage and then,
Acne has got four grades basically. The first is the comedonal acne, where you have only these blackheads and whiteheads. That's the first stage of acne. The second stage is a papular stage of acne, where you get slightly bigger lesions, and some of them could be infected. In the third
right.
stage, you get a little bigger ones like nodules. The fourth stage is where you get nodulocystic acne. It's a very big
Right.
one, painful ones, which starts bleeding. There'll be a lot of pain, and even a lot of body surface area is also involved. That is the fourth stage. So you have four stages of acne.
Right. Uh, what are the treatment options for different grades? Like for the initial stage, what can be the treatment options?
The initial stages, we can put them on face washes. We could put them on some topical creams which contain salicylic acid, which contains adapalene, tretinoins, and topical clindamycin, minocycline. Those kind of medications work. If there is a
Mm-hmm.
lot of pustules, then probably we'll have to add an oral antibiotic also. Whereas when it comes to stage 3 or stage 4 acne, in that cases, topical medications might not be of a much benefit. In that case, we'll have to add a oral medication. So oral antibiotics, and in some cases, we might also have to put the patient on oral isotretinoin.
Right. Doctor, as you have already mentioned, the worst case scenario of acne. So, what treatment do we usually take in those scenarios?
The worst cases.
Yes, yes, doctor.
Yeah. So it depends on how it is. So first we have to examine the skin. Suppose if you feel there are a lot of pustules, there's a lot of infection, then we would initially start them on oral antibiotics, maybe for 10 days, 15 days, and then review the patient. So once the infected acne has come down, so the next what we have to do, so we if there are a lot of comedones, then probably
Mm-hmm.
we can do few sessions of chemical peels. We can extract and remove the comedones, and then after which we can start the patient on oral isotretinoin. If it is a female patient and if she's having any hormonal issues, then we'll also have to do an underlying hormonal check. We have to do an ultrasound abdomen to see if she's having any polycystic ovaries, or do a hormonal workup, do a hormonal blood investigation, and then start the patient sometimes on hormonal medications if needed. If any of the hormones are little high, probably a hormonal medication along with isotretinoin will help. Whereas it's a male patient, and we can just put them on isotroin. We can calculate the dose based on the weight of the patient, and we'll have to give it for a specified period of time. Minimum 3 to 4 months at least they will have to continue the treatment for.
Right. Doctor, normally for all the people who have sensitive skin,
Hmm.
they are extremely worried, in case they usually are not able to apply anything for, the
Hmm.
normal products, they usually don't go for them. So
Hmm.
what treatment options can be there for those people who have sensitive skin?
So in sensitive skin, we should try to avoid these face washes which contains glycolic acid, salicylic acid. We should keep to a milder ones, maybe like mandelic acid or something milder. And then we should also try to avoid using adapalene, avoid using tretinoins, because they can further irritate the skin. They can increase the sensitivity of the skin. And we'll have to put the patient on a proper moisturizer. Topical antibiotic gels will help. Oral medications will also help. And probably few sessions of hydrofacials also help for patients who have a little sensitive skin. And light therapy also helps. We can put them on LED light therapy for patients who are very sensitive and for whom we are not able to do peels, or for whom we are not able to put any of the topical tretinoids. We can do light therapy for such patients.
Right. Doctor, well, we know that skin is such an important part of our body. It brings half of the confidence in a person if we have a healthy skin, if we have a glowing skin. For all the people who does not have acne right now, for the people who are watching us, who are not currently suffering from acne issues, but uh, if they want to, manage or so that it does not happen to them in future, what can be those management procedures?
So regular cleansing of the face is very important, at least twice a day. If you're using a lot of makeup and stuff, you have to make sure that you remove your makeup before you go to sleep in the night. The
Right.
next important thing, you should avoid using any oil-based products on the face. So recently, after this Instagram has become famous, so a lot of people start using what the influencers use. They start buying a lot of
Right.
products online based on what influencers use. Each skin is very different. So your skin will not be like that. So you shouldn't like blindly follow what those people use. So before starting to use such products, you'll always have to check if they contain any oil-based products, because applying oil-based products might not suit everyone's skin. And then you can use certain mild cleansers which contain lactic, glycolic, mild salicylic acid. 1% salicylic acid cleansers is something which you can use. And even doing hydrofacials and cleaning up the face like once in 3 months might also clean all your pores. It might remove all the dirt, the debris. It might remove the blackheads and whiteheads, and it can prevent acne formation.
Right. Well, I think these are the basic things which we need to take care on a daily basis. We cannot get tired of doing it. We cannot just think कि आज नहीं करते हैं कल कर लेंगे. Just like we get up every morning and brush, it should be a daily
Yeah.
routine. And moving ahead, doctor, with the next question. Our next question is again a very important thing on our day-to-day life is diet. How important is diet on maintaining a skin healthy? How important is it?
Yeah, diet is very important as far as acne is concerned. There is a lot of correlation between diet and acne. In fact, a lot of skin disorders, there is a relationship between diet and skin. When talking about acne, we'll have to cut down foods which contain dairy products, taking a lot of dairy products, drinking a lot of
Mhm.
coffee, tea, milk-based products, ice creams, a lot of milkshakes. All that will have a profound effect. So you'll have to try to cut down on dairy products. 1 cup of curd is fine, but you shouldn't take it in excess. And cutting down on sweets. You have to cut down mainly on sweets and chocolates because sweets and chocolates and increase the insulin like growth factors, which can have an effect on acne. And the third thing is whey protein because a lot of people seem to take a lot of whey. People who are going to the gym, they're like
Right.
very lazy to have proteins cooked and so they tend to replace it with whey. So whey
Mhm.
protein can also cause a lot of acne. So mainly you'll have to look out for these three things. You have to cut down on sweets, dairy products, and whey proteins.
Well, I
And
think this is a very
also,
important thing which doctor has
also
just,
on
yes, ma'am.
the deep fried stuff. The deep fried, oily stuff also, you'll have to limit the intake of those kind of foods.
Right. Basically, all we have to do is have a healthy diet.
Lifestyle,
That's
exactly.
the least we can do. Avoid junk,
Yeah,
avoid refined oil, avoid
correct.
processed. These are the basic things which
Yeah.
we normally have to do in order to maintain a healthy life, in order to stay away from diseases. Just the basic things. That's it. Doctor, also you have mentioned about whey protein, and not many people know about it. Uh, People nowadays, they are very keen towards maintaining their body physique. They want to look good all the time, and in that manner, in that way, they tend to take over the counter medicines. Maybe, as you already mentioned, whey protein is another amongst them. What do you have to say to those people who are very keen towards maintaining a healthy body, and they take all the shortcuts to get that fit body?
Instead of whey, pea protein would be a better alternative actually. So whey is mainly from milk, so that can aggravate acne. So if you're taking whey and if you're not developing breakouts, it's fine. But if you're taking whey and then you have a lot of acne breakouts, it's better to switch over to a pea protein if you're very concerned that you need to take this much amount of protein. You're doing some bodybuilding or stuff, then probably you can switch over to pea proteins. That is one option and probably try to incorporate a lot of proteins in the diet, taking in the form of eggs. You can take in the form of meat, your channa, rajma, and all that. Try to incorporate in the diet, or switching over to pea protein will be a better option.
Doctor, also another important topic is application of sunscreen and moisturizer. How important is it in acne management?
Sunscreens, yes. If you're sunscreens are not directly related to acne, but if the patient is they're doing some procedures, they're undergoing some chemical peels and stuff, the skin is going to be more sensitive. Or if you're applying any of these topical retinoids like adapalene, some of the tretinoin, which the dermatologist prescribes for you, those creams can actually make your skin a little more sensitive. In that cases, you'll have to use a sunscreen in the daytime when you're stepping out because otherwise the pigmentation can get more. And
Mhm.
moisturizer is also important because most of these retinoids and all that causes a lot of dryness on the skin. So when there is a lot of dryness and flaking, that could increase the sensitivity of the skin, that can cause a lot of rashes. And also patients who are put on isotretinoin, that also causes a lot of dryness on the skin. So in order to avoid the side effects of the oral medications, to avoid the side effects of these topical creams, sunscreens and moisturizers have to be used.
So,
And
speaking
moisturizing
about,
also, you have to be
right.
careful. You shouldn't use very thick moisturizers like butter-based moisturizers, oil-based moisturizers are better to be avoided.
Mhm.
Non-comedogenic ones is something which they always have to check before buying the moisturizers.
Right. Doctor, as you have already mentioned about moisturizer, please let us know about sunscreen as well. What sort of a sunscreen should we use in acne?
Sunscreens are fine, but because most of the sunscreens they have this label mentioned non-comedogenic sunscreen, so those kind of sunscreens will be totally fine.
Right, right. Doctor, we'll quickly move on to the next question. Our next question for you would be again another important topic. Any lifestyle changes which we need to take
Yeah, physical activity is very important because most of us right now have a very idle lifestyle. We sit like for 8 hours, 10 hours a day. We hardly move, hardly 3,000, hardly 1,000 steps also we walk in a day. So we have to make sure that we have some form of physical activity at least 5 days a week. It could be in the form of jogging, running, or just brisk walking. It could be in the form of yoga, Zumba, whatever you like. Some physical activity is actually very important.
So, doctor, we are basically saying that most of the problems or diseases it either arise from our lifestyle change or
Hmm.
the food habits which we are taking. These are the basic things which, if we bring into control, half of the issues get resolved. So, the basic thing of life. The basic changes, and we are good to go. And hopefully, if we take those normal the things, if we maintain those normal things in life, um, we definitely do not have to go to the hospital again and again. Doctor, we can see our viewers asking questions. We have a question coming from Pooja Sharma. Pooja asks, are there any over the counter products or home remedies that I can try to elevate the patches of skin?
What patches?
uh, any skin patches or
There's nothing like a specific
cured
cream
by
which
home
can,
remedies.
no, there's nothing like a specific cream which can treat all the skin patches. So any patch
Right.
on the skin is like totally different. So we have to look into what it is, and then accordingly only we can give the cream. There's
Mm-hmm.
nothing like a particular cream which is going to treat all the patches. So if you know what the patch is, only then we'll be able to treat it accordingly.
Right, because doctor, we are also speaking about home remedies. Any home remedies for acne management?
Home remedies as such, nothing is going to work much. Maybe keeping turmeric has got a little bit of antibacterial effect that might help if the patient is having a lot of pustular acne. Or grinding neem leaves and keeping the neem leaves on the acne might help to reduce the infected acne, the pustular acne. Otherwise, nothing is going to work much.
Right. With that, we have another question coming up from Kirti Kapoor. Asks, what is the expected timeline for improvement, and when should I follow up if there is no change?
You'll have to wait. Depends on the stage of acne. By any acne, you'll have to give it at least 2 months time. If still
Mm-hmm.
it's not responding, if you're not seeing changes after 2 months of treatment, then you'll have to investigate further. Either we'll have to change the line of treatment, the modality of treatment has to be changed, or we'll have to look into the underlying factors. The underlying root cause has to be analyzed.
Right. I believe, Kirti, you have got your answer. Doctor, also there is another question for the ladies who are about to, who are pregnant right now. How uh, how can we, manage acne for them? Or
In pregnancy, we do not. Hmm.
is there any tendency of having acne after the pregnancy?
Uh, some people have aggravation of acne during pregnancy because of the progesterone hormone and even after delivery. When the
Mhm.
patient is pregnant, we generally do not put them on any medications, only if the acne is severely infected, it's affecting the quality of the life for the patient. If it's very painful, in that cases, maybe a short course of oral medications. Topical creams, maybe something like benzoyl peroxide is much safer. Otherwise, we do not give them anything else. The same applies to the patient when the patient is feeding. The same thing applies. If it's like really affecting, if it's like really painful or something, then we put them on oral medications. Topical benzoyl peroxide creams are safe. Other than that, we do not do anything. We wait for the patient to stop feeding and only then we start with the treatment.
Right. Doctor, another question which will definitely bring a big sign of relief for all the viewers. Is acne curable or it can just be controlled?
Acne, see, usually the acne which starts from the age of 13, 14, 15. that
Mhm.
usually settles by the age of 21, 22. For most of them, it settles by the age of 21 and 22. Some people might have persistent acne, which might persist throughout their adolescence, even in their 20s and 30s. In that cases, we'll have to look into the underlying cause. Suppose if you have an underlying hormonal issue, when we treat the hormonal issue, the acne actually gets treated.
So,
Acne is
yes.
treatable, yes, it is treatable. For a lot of patients, it's treatable. Yeah, it depends on the cause of acne, but most of the patients, it's treatable. It might keep recurring till a particular age. After that, it's usually it settles.
Also, doctor, is hygiene another factor of occurrence of acne?
Yeah, yeah, definitely, right? You have to actually, the good hygiene is important for anything. For skin, yes, definitely.
Right. Doctor, we have another question coming up from Faria Beg. Asks, what could be causing the patches of skin on our body? What could
What
be causing the
patches?
patches of
Because
skin on our body?
patches is a very generalized term. Patches
Right,
could be
right,
anything. So,
right. Maybe she has a question about melasma or something like melasma. Uh,
melasma is something which a pigmentation which happens on your cheek. It can come on the nose, it can come on the forehead, it can come on the upper lip area.
mhm.
So, you want to know what has to be done for those kind of patches?
The causes, just the causes of
Melasma,
melasma.
usually when you get these black pigmented patches on your cheeks, on your nose, on your forehead, and all that, that's melasma. Melasma usually has got an underlying hereditary factor. It's genetic. So, any of your, if your parents, grandparents, any of them had it, then there is a chance that you can develop melasma. Hormonal changes also induce melasma. So, people generally tend to develop melasma during their pregnancy or during
Mhm.
menopause. The other thing is sunlight. When there's a lot of light exposure, melasma can get activated. So it's
Right.
sunlight, hormonal, and hereditary.
Right. Well, Faria, I believe you have got your answer. And if you want to know in detail, you have the experts next to you. Please visit your nearest expert. We have another question coming up from Suhana Thakur, who asks, I believe doctor has already given the answer. Doctor, can certain food make acne worse?
Yeah, sweets, dairy products, oily stuff, and whey proteins.
Right. Suhana, well, that was the answer from our expert live. Doctor, as we are talking about, food and acne, uh, any sort of food which can, help us reduce acne?
There's nothing of that sort, but there are only the certain foods which you have to avoid. Anything, whatever you eat healthy, a lot of fruits and vegetables, and avoiding a lot of junk will do. That will help with controlling acne.
Also, doctor, let us know if this is contagious anyhow.
No, acne is not contagious.
Well, I believe most of our questions has been answered in this life. Before we leave, doctor, any closing remark for all our viewers?
Yeah, a lot of people tend to be affected with acne. The only thing that you see acne and that age in teenage is common, so you don't have to worry. It's going to settle after a particular age. But certain things which you have to keep in mind. The first thing, you shouldn't keep popping the acne. So that is a habit for a lot of people when they're studying, when they're doing some other work, they keep popping the acne, which is something you should avoid. You should never take your hand or fingers to your face. You should never pop the acne because it can leave a scar. So once it leaves a depressed scar, the scar is going to stay for life. The pigmentation which the acne leaves behind will fade. It might take 6 months, it might take 1 year, it will fade. But if it develops a depressed scar, it's not going to go. It's going to stay there for the rest of the life, which has to be treated only with laser. So never take your hand. The next thing is, if you're getting very big acne, very cystic acne, in that cases, you definitely have to get treated aggressively. You need to go to a dermatologist. You need to get treated, especially you have the big cystic acne, because these cystic acne can leave behind a scar. So that, as I told you, these depressed scars are not going to go. So whenever you have
Right.
really big cystic acne, in that cases, you get treated definitely. And the next thing is never pop the acne. That's very important.
Right.
And don't
Well,
do any
viewers, yeah,
self-medication for
yes, doctor.
acne. And yeah, each skin is very different. So always get a consultation. Check what you can use, what is suitable for the skin, and then follow accordingly.
Right. Well, viewers, Thank you so much for your excellent participation. That was Dr. Sindhu for us. Thank you so much, Doctor, for your
Thank
valuable
you
time.
so
It has
much.
been a
Thanks a lot.
very informative session for our viewers, and it was great to hear from you. We look forward to many more such sessions ahead. And for all the viewers, thank you so much for joining us today, and stay connected to our beautiful Spotless Skin page. Thank you so
Thank
much.
you.
Have a
Thank
great
you so
day.
much.
Stay
Thank
safe and
you.
stay healthy.